Well, that was a quick summary of how medical cannabis can help with various conditions. And I do have to mention that there are a lot more conditions that it does help with. We know that there are at least 200 different conditions that medical cannabis does address. And we'll be actually doing more webinars on the different conditions, how cannabis can help, and being going in depth on those particular topics. We'll be doing a lot of that next quarter. But in the meantime, we have some reference material that's here. What I'd like to do right now is jump into some of the questions that were submitted. So first question is, if most terpenes treat pain and inflammation, how do I know which ones are best for my condition, which includes chronic pain? Related to that is the optimum dosing, high CBD, low THC, to function all day without pain. Is there more to it? First of all, the, the there are a number of different terpenes that can help you with pain management. And what's interesting is cannabis has just been great to handle with pain. I saw a article that was actually published. It was put out there. It's actually a joint study that was done between the Israelis and also the some German researchers that showed that cannabis is actually better at treating pain than pharma drugs, which I found very interesting. Um, and a lot of it has to do with the terpenes, and I think that's something to really pay attention to. And I think that when you're trying to, I think in our world, we try to do the best and the most optimal. And what's interesting about holistic medicine is cannabis doesn't necessarily need to be told what to do. With your endocannabinoid system, it knows that you have a problem and it knows which cannabinoids to be able to produce to be able to address that particular condition. Now, when you're talking about the best ones that are there, obviously beta caryophyllene, myrcene are just great. And it's been something that people have used quite a bit. What's interesting is in order to be able to really home in on the pain, pay attention to the source of pain. Where is that pain coming from? Is it acute pain? For example, in my case, I have herniated discs in my neck, and I really need to home in on that. And in order to do that, I can use topicals, for example, which will help. I do need something for longer term relief because topicals last for about an hour or two. And so I use tincture drugs. I do use vape pens to be able to get pain relieved immediately. And in the evenings, I actually use edibles before I go to bed. I'm a chocoholic and I take a couple squares of chocolate before I go to bed, and it helps me fall asleep and stay asleep. So to know which one is best, I would say you don't have to pick one or the other. It's not like you have to choose a terpene. You can put these things together, they work together. Your body is actually the main regulator. Your body knows what it needs, it knows how to treat it, and it'll actually use those terpenes and provide them and correctly to be able to go out and be able to address those particular conditions. For example, if you're looking at things like multiple sclerosis or neuropathy, we know this is numbing. We know this is some numbing and tingling. We know there's weakness that you end up getting in there. We know that there are various places of your body that can be very open to both MS as well as neuropathy. So once we understand where it's coming from, we can then use the various routes of administration or ways of being able to take cannabis to address it, and then build a plan that actually allows people to be able to treat themselves, not just when they wake up in the morning, but to go through the day, use it in the evening, and fall asleep at night. I think that's something that's very, very important. Now, the recommended terpenes, for example, for MS and for neuropathy, for example, limonene is great. We talked about pinene. Again, just be careful with pinene if you have a PTS, because it does work. It does bring back short-term memory. And beta caryophyllene is always great. I'm a huge fan of eucalyptol. I think it does a lot of different, has a lot of positive things. And I think what you really want to do is really look at a terpene profile with the certificate of analysis the from the dispensary, because they'll tell you what products are there. Now, here's the other side of it. If you're looking at terpenes for MS and neuropathy, avoid things like linalool, beta-myrcene, terpinolene, germinal, and boronol. They're not necessarily something that's going to help. They're not going to hurt you, but they're not going to help. What you want is the terpenes that actually address this particular condition and really home in on your particular condition. And again, the routes of administration are really, really key. You asked the question, is an optimal dose high CBD and low THC? I'm going to answer that, and I don't know how to answer it. Your body does. Your body will tell you what works for you. I think every person's body is different, just like people have different reactions to caffeine and alcohol. The same thing will happen with cannabis. You'll have a different reaction to it. I have friends of mine, for example, and when you talk about alcohol, they have one drink, they're done for the night. I have other friends of mine who'll drink the whole bottle and they're just getting started. So what we really want to be able to do is we really want to go through the dosing process to understand what's the therapeutic dosing level that's optimal for you. I have found that by reducing inflammation, at least for me, it reduces the pain. And so I have found that using a high THC or higher THC to higher CBD to THC ratio really helps me be able to address my particular pain that's out there. But again, you have to go through the dosing process and understand your therapeutic dosing level. Once you do that, then you can make the decision of how much THC and how much CBD that you'll be using and putting it all together. Let's take on the next question. Can you describe the difference in hybrid, indica, and sativa? This is a great question. When I first heard about cannabis, I was in college, and that was years ago. I won't date myself, but it was everybody was talking about indica and sativa. Those were the main types. Those are varietals of the plants themselves. Indica tends to be a genus of the plant that really provides some calming effects. Sativa is a genus of the plant that really gives you energizing traits and properties to help you with that. And what's happened over the years is as people have looked at using cannabis for various conditions, for example, whether that's sleep, whether that's pain, whether that's arthritis, the people that are making the medical cannabis, so these are your dispensaries, are starting to put together a combination of cannabinoids and also terpenes to be able to address those conditions. And to do that, what they're doing is they're blending the indicas and the sativas together, and that's where you get the hybrid. So it's not pure indica, it's not pure sativa, it's a combination of both. Think of it very much like if you're familiar with how winemakers make wine, they tend to blend different varietals of wine to produce the actual wine that you really particularly like or the type that's good for that particular condition. Same thing for scotches. They do the same thing there. Same thing with going on into the cannabis business, where they're actually blending indicas and sativas together, paying more attention to the terpenes and the cannabinoids that address that particular condition than whether it's indica or sativa. So really, today what we have is a series of products that are what they call indica leaning, meaning they're relaxing and calming products, or sativa leaning, which means that they're energizing products. And most of the products that you're purchasing today are really hybrid products. And I wouldn't shy away from hybrid products. In fact, hybrid products are really the way to go because they've been crafted to address a particular condition. Again, pain management, sleep, arthritis, whatever is out there. So I hope that's kind of a quick overview. But I want you to also understand, in the 60s and the 70s, you could buy indica and sativa products. Today, very hard to find a pure indica or a pure sativa product. It's not that they're not on the market, but they're very hard to find. That's because, again, all the research that's been done, we've actually discovered more cannabinoids, we've discovered more terpenes, we've discovered more strains. And so as people are crafting solutions, that's where you get the hybrids that come into play to really address various conditions there. And I hope that answers that particular question. Next question is, interested in anything regarding the medical benefits of THCA? THCA is a great product. In fact, I'm a huge fan of THCA. That's the good news. The bad news is it's hard to produce THCA. I know there's only a limited number of dispensaries that actually put this out on the market. But really what THCA does is THCA addresses pain management, does a great job of that. It helps with a lot of the, if you have head injuries, it helps with a lot of what I call the mental conditions. Mental conditions meaning some of the capabilities to stay responsive, to stay awake, to stay present. That's really there. And THC is great. It works with the CBD that you have if you're taking any CBD to be able to provide an anti-inflammatory product that's there. So there's again, I would look at THCA as really something that really helps a lot with both a number of different conditions that relate to pain. So if you have conditions like pain management, neuropathy, fibromyalgia, arthritis, a whole bunch of other conditions, or more importantly, if you had an operation, like in my case, I had my knee operated on, it's something that can really help quite a bit. Again, the hard part is to find a THCA product on the market because, again, it's usually put together just so that you understand where it comes from. When the original plant is made, when that little cannabis plant is put into a seed and it pops up and that little green little flower, a little sprout comes up, the first thing that comes up is what they call CBGA. And CBGA means it's an acid. What that does is that morphs into THCA, CBDA, and CBCA. That THCA is what we're talking about right there. And by the way, it gives you a tremendous amount of benefits from the standpoint of managing pain. But because it hasn't converted into THC, it doesn't get you high. And that's what the key to that particular product is. It's a great pain management product without getting you high. And again, I know a couple of dispensaries that actually provide those products. I use THCA. And I think it's something that you pay attention to, especially if you're trying to manage pain. I'm a great fan of it. But again, it's typically hard to find. But if you can find it, I'd recommend using it, especially if pain management is one of the uh, symptoms that you're looking at managing. Next question is, what's the best way to enjoy the THC without using flower because of emphysema, lung conditions? Well, first of all, flower is not the only way that you have to take medical cannabis. It's been very well known that we have routes of administration that include tincture drops, topicals, edibles. I think one of the keys here is edibles that come into play, and that really helps quite a bit. And I think also if you have a lung condition, don't shy away from things like the sprays and or vaping, because when you look at vaping, you're not burning the product like you have with cigarettes, where it burns the product and produces a carcinogen. Vaping actually steams the product, be able to bring out the benefits of cannabis without burning, and that really helps quite a bit. Now, remember or pay attention to the fact that in the pharma world we have inhalers. I've had people that use asthma inhalers for years. They inhale it into their lungs, and what it does is it helps the lungs be able to recover or be able to get into a condition that it backs down that asthma, and being able to people can able to recover and be able to lead somewhat of a normal life. Now, I should point out the same is true for cannabis. Cannabis is very good at healing a lot of the conditions that are inside your lungs. Anytime you put anything into your lungs, be very, very careful. I don't recommend that you pay attention to what you're doing with it, but I can tell you that cannabis, especially vaping, is a lot safer than smoking, and it works right well. But if you have emphysema, I would stay away from vaping altogether. I'd pay attention to using your topicals that last between 1 to 3 hours. Pay attention to using edibles. Edibles are great. Now, the thing about edibles is they work, they taste great. There's a lot of them on the market. Pay attention to the terpene profile of the oral. A lot of people put out oral products, gummies, brownies, things like that. They don't have a proper terpene profile. They're just THC only. That's not going to help you with your medical condition. Pay attention to the terpene profile of the oral that you're taking. It'll take anywhere between 30 minutes to up to 3 hours to work, but they'll work anywhere between 6 to 10 hours. So, for example, in the evening when I want to fall asleep, I grab a bar of chocolate, take a tab or two of that, helps me fall asleep and stay asleep for the entire night. Where if I use a sublingual, for example, which works very well, it'll provide the THC that I need to address my condition, but it's only going to last between 4 to 6 hours. So if I take it at 10 or 11 o'clock at night and I fall asleep, I'm going to wake up at 3 or 4 in the morning, and I'm going to need to do something else to be able to address that particular condition. So, what other forms are out there? Sublingual works great, giving you that 4 to 6 hours of coverage. Takes about anywhere between 15 minutes to a half hour to work. Orals, which are your gummies, your brownies, all that fun stuff that's out there, very much something that you could use. And again, if you have a lung condition, this is a great way to go. But pay attention, it could take anywhere up to 2 to 3 hours to work, but it'll work anywhere between 6 to 10 hours. And then, of course, topicals always work great. I found that for incident relief, topicals are really the best way to go. It really helped me quite a bit. And of course, in my particular case, I'm a big fan of vaping, but if you have a lung condition, stay away from putting anything else into your lungs. I wouldn't be afraid of vaping, but I would try to avoid it. There's other routes of administration, and just take advantage of that. I hope that helps quite a bit. So I hope that answers that particular question of the best way to approach it without necessarily smoking. Other question is, what's the best for chronic pain for rheumatoid arthritis or RA? This is something that I have. I'm starting to get RA in my hands and things like that. Welcome to being, as my sister tells me, we're getting old. So um, the interesting thing is the bright terpenes are really looking at linalool, myrcene, and beta-caryophyllene, as well as pinene. And I always put a tag on pinene because, again, if you have PTS or you're worried about memory issues, it brings back short-term memory, and you may not want to recall some things that are really something that's out there. Now, arthritis is denoted by joint pain, redness, swelling, that type of thing. And not only do the terpenes help quite a bit, but I'm a huge fan of what they call RSO. This is Rick Simpson oil. They also call it today FSO, which is full spectrum oil. The difference is that when Rick Simpson made the product 25 years ago, the base that he was using, the base ingredient, was one thing. And today we've actually got better base ingredients. So that's what they're using today, and that's why they call it FSO. But it's the same process that's out there. And what it does is it retains almost all the terpenes in the plant itself, in the product itself. That particular cultivar is rich in all the terpenes, and it's really a great way to go. I'm a huge fan of RSO. I do martial arts, And at my age, I obviously have some aches and pains from doing that. And I found that if I use RSO right after my, or actually just before and either before or after my particular martial arts workout routine, it really helps me address my pain, my inflammation, and candidly makes me feel a lot better. So arthritis is something that I've seen a lot of positive things from people who've had arthritis that can use it, that have used it and really got their life back. And people where their hands were actually clenched together because that's how much arthritis had affected them. And literally within 2 to 3 weeks, their hands loosened up and they were able to eat, use a remote control, be able to swing a golf club. In fact, one of the ladies that I work with had her hands actually swollen to the point where they were locked shut. And today she's back to knitting. So it's something that we do know that works. Again, it's going to take a week or two, maybe even a month to have it really work because it wasn't something, or this arthritis isn't something that just comes on overnight. And it's not going to completely get rid of it, but what it's going to do is it's going to let you manage it and be able to get a lot of that movement back that you need to be able to reclaim the movement and the use of that particular joint. So I hope that answers that particular question that's there. Do cannabis products impact memory and recall? You know, this is a great subject. This has been debated uh, since cannabis really began, and especially today in this particular market. You know, it's interesting that one of the things that cannabis helps you do is to focus. I know that a lot of artists use cannabis. You know, you hear about musicians, you hear about art, people who make art. You hear a lot of architects and things like that. The reason they use cannabis is because it helps you focus and really stay on and being focused on something helps you recall what you need to be able to. It's there. Now, it also is if you take a lot of cannabis and you actually get stoned or get that heady feeling, it will cause you to be able to not recall or be able to not necessarily have the memory that you had before. So the answer to your question is if you know your therapeutic dosing level and you in fact use it correctly, it will help you quite a bit. If you in fact uh, overuse it, in other words, you go past that therapeutic dosing level, you could have some problems. But I do know that in many cases, I have talked to folks who use cannabis when they're working on various projects, and it helps them focus and be able to get the job done. I know myself, I've used cannabis when I have some projects to get done, and it just helps me get a lot of the work done that I need to get done. Same thing with my wife. So the answer is that yes, it does have an impact. As long as you stay with your therapeutic dosing level and you know your tolerance for cannabis, you can actually use it positively. And again, if you go past that, there's going to probably be some areas where it's not going to help the memory and the recall very much. I hope that answers that particular question for you. Other question is how safe is using vape pens once regarding lung health, and are the chemicals in them dangerous for long-term health use? Is dry flower chemical free? Well, first of all, is dry flower chemical free? That depends on the certificate of analysis. And Lee, thank you for bringing this up. Really, you want to pay attention to the certificate of analysis because in that COA, as you'll see in this, if you read this, it shows you they've tested for pesticides, they've tested for mold, they've tested for a lot of environmental things. That really helps you understand. You look down at the bottom where it says analysis summary, you'll see the pesticides, the heavy metals, and things like that. The answer is yes. Now, if you buy a product on the street or you don't have a COA that talks about a complete COA, meaning talks about not just the cannabinoids in the product, but also talks about the terpenes and talks about the different background things like pesticides, heavy metals. Then you it's kind of a crapshoot. You just don't know what's going to work, what isn't going to work. I'm a huge fan of going to licensed dispensaries, looking at the COAs and knowing what's in that particular product. What I'm not a huge fan of is I go to a number of these what I call smoke shops, great products with THCA. No question, it's a if you want to if you're a stoner and you want to get high, it'll work. But I don't know this. But I've not found one that has been able to tell me the terpene profile, nor more importantly, have been able to tell me the background information, the pesticides, the heavy metals, and things like that. That's why buying street products. Not that you shouldn't do that. I just don't recommend doing it. And the reason for that is you just don't know what's in that particular product. I want to know what I'm using. I want to know what my medications are, and I want control of that. I'm in control of my body. I want to stay that way. And I think the COAs are a great way of being able to answer that. So I hope that answers a lot of the question that's there. Stick to the COAs and really, is it chemical free? Most of them should be chemical free. Okay, that's out there, especially if you buy from a dispensary. And again, how safe is using a vape pen? Because it's heating, it's not burning that material. It's much safer. It's more of a vape or a steaming process than it is a burning process, and it's a lot safer. However, anything you put in your lungs, be very, very careful and make sure that it's actually contributing to the health of your lungs and not being detrimental. It's there. Next question is, what method is best way to use THC medically for anxiety and sleep without creating problems elsewhere? Related to that is, if anxiety and sleep are the primary struggles, what are the best forms of THC to use? We did a whole webinar with Dr. Greg Holt on sleep. We've done some webinars on anxiety and stress. You can watch those and they'll actually give you information to dig down into that particular subject. But actually, the best way to use it is really two things. First of all, understand your therapeutic dosing level. How much THC can you tolerate, and actually how much CBD and THC that you put together to be able to address your particular condition. And so what's interesting is, what's the best way to use it is the one that you're comfortable with. One of the nice parts about cannabis is there's a number of different routes of administration. We can smoke it, we can vape it, we can do edibles, we can have topicals. There's a wide range of things you can do. Now, what's interesting is, you should use a product that you're comfortable using. A lot of people don't like to smoke. Don't use the smokable version. Use the tinctures, use the gummies. Some people really do not really enjoy using the tinctures. So then again, you have gummies, you have topicals you can use that are out there. So really, I would say the best method is what you would use. And then from there, pay attention to the terpene profile, as we mentioned earlier, to make sure the product that you have the terpene profile. Again, that goes back to checking the COA to make sure that the product, in fact, matches your particular condition. I cannot tell you the number of times where I've talked to patients who say cannabis isn't working for me. I've checked out the product that they're using and found out that the terpene profile does not match their condition. So without having the right, basically, ingredients, they're not going to get their particular condition really addressed. So when you ask about what's the best form for THC to use, really pay attention to the terpene profile and pay attention to a route of administration that you, in fact, will use. Now, next question is an interesting question that came up to play, and that is dry mouth and dental concerns. Now, what's interesting is what's interesting here is that when you take a look at dry mouth, when you use cannabis, what happens is that it basically, you should also drink a lot of water anytime you're using cannabis. Candidly, anytime you're using any holistic medicine or any pharma medicine, you should drink a lot of water with it, because water helps your body absorb that particular, I'll use the word drug, and or in case of cannabis, medication that can really help you that's there. Cannabis, especially working with your endocannabinoid system, causes your body to be able to really absorb this into your body, which requires you to use more water, and or you need water to be able to do that. So I would say, yes, you can get dry mouth from using cannabis, because what it's doing is it's actually working with your body to be able to absorb that medication into your body, and it really puts a real emphasis on you being able to do that. Now, what's also interesting is that there was a study that was done talking about dental concerns done out of the University of Buffalo, but I think the real key is it was a survey. It wasn't a study. I've not been able to find any studies per se on the fact that cannabis has contributed to tooth loss or to cavities. However, I do know that cigarettes do contribute to cavities and tooth loss, and I don't think it's something that we know and we can make a definitive answer to that, because the studies haven't been there. And I don't want to speculate, but I would say that there's a good chance that if cannabis is helping to relieve the inflammation, it's probably going to help with what I call bone growth. It's going to help quite a bit with relieving the problem that you have with your gums. However, it'd be important that we study that and really understand it. And I don't want to make any snap decisions. I would not avoid using cannabis if you're worried about cavities and tooth loss. Let me put it to you that way. It's not a condition that I've seen and people have talked about. I've tried to look at and find a number of studies. I really haven't been able to see much, because it hasn't really been something to really pay a lot of attention to. But I'll go back to what I said earlier. Anytime you're using cannabis or any holistic medications or any pharma medications, pay attention to drinking a lot of water. I do a lot of exercise. It's one of the things that's in my world of being a senior citizen. It's use it or lose it. And I drink a lot of water during the day. And the reason for that is because I'm really trying to give my body the ingredients that it needs to be able to get the benefit from the exercising that I'm really paying attention to. So I think dry mouth is something that can happen, but it can happen when you work out. It can happen when you're doing a number of different activities. pay attention to making sure your body has the ingredients it needs, and water is critical to being able to have your body be able to address its particular medical condition. Let's drive on to the next question. Is there any research out there using THC for the benefits of CNS, it's the central nervous system, for conditions like essential tumors? Since this is a condition that does respond to short-term, does in the short term to alcohol, unlike Parkinson's. Well, what's interesting is that cannabis has been known to really help quite a bit with tremors. Very famous is the CBD studies that was done with on epilepsy, and they've shown children especially have been able to get their tremors and everything reduced. I have friends of mine who have gone through with their children having some real epileptic seizure issues, and they found that cannabis can help quite a bit with that. And the question is, can it help with the central nervous system? The answer is yes, and that's because the CB2 receptors and the CB1 receptors are primarily in your spine and in your brain, in your spinal cord in your brain. The CB2 receptors are primarily in a lot of your fatty parts of your body, your central nerve, your organs, and your white blood cells and things like that. That's where they're actually located. So the answer is yes, there is research on the benefits of this, and really what you want to do is pay attention to, again, that terpene profile that addresses that particular condition of the tremors that are there. It isn't like a pill that you take and tomorrow it goes away. It took a while for these tremors to come on. It took a while for these particular conditions to happen. For example, I'm not addressing Parkinson's, for example. It could take anywhere from 3 weeks to a month to really see the benefits of it, because it takes a while to reverse or to really get a handle on and trying to manage those particular conditions. But the answer is yes. There's a lot of research that's out there. We know that it helps with tremors. And again, a lot of the research is based on the type of condition that's really out there, whether that's epilepsy or whether it's a condition that happened from, let's say, a head injury or something like that. So the answer is yes, it's out there, and it has been very effective in addressing that. I'd use cannabis before I'd use a pharma drug to address tremors, because we know it works very closely with your body and helps with that particular condition. Well, listen, I would like to thank everybody for joining me tonight. I know that this is talked about the range of conditions that it really addresses. There's a lot more that cannabis can do, and I think that it's something that is, if you're interested, please let us know. Please follow our particular webinars. I know if you go out to our YouTube channel, Marijuana Aware, we have a lot of webinars on various conditions that talk about sleep. It talks about arthritis. It talks about pain management. We talk about fibromyalgia and neuropathy. We have webinars on all of those. And please feel free to dig down on those if those are your conditions, because you want to know what to use. You want to know what's best for you. And this is something that you really should do your research on any product, cannabis or not, before you go heading down into it. And again, if you have any questions, please let us know by sending an email to events@at marijuanaaware.com. And please join us for the next series of webinars that we're going to be doing. Next week, we're going to have a very fun webinar on edibles for wellness. I'm talking about how to cook with medical cannabis. And then a very special webinar we're going to do on the 19th of March. We're talking about cannabis for not only veterans, but also first responders. Thank you very much for joining me, and we look forward to hearing from you.